to the first episode of the Mechanics of Anesthesia podcast. I'm Eric, alongside my co-hosts Ben and Dylan. We are a group of student-registered nurse anesthetists, or CRNAs, currently in our second year of anesthesia training. Just to be clear and upfront, this podcast is not affiliated with any academic or healthcare institutions. In addition, we do not own any rights to any music utilized in this podcast.
Like Eric said, my name is Dylan. I'm just going to tell you guys a little bit about our podcast. So whether you're a nursing student, registered nurse, SRNA, or even a current CRNA, we're aiming to provide an easy-to-understand resource to learn more about the mechanics of anesthesia, whether it's the science, the training, and also just getting into school in general. We'll have a mix of content throughout these podcasts discussing anesthesia pharm, physiology, and anesthetic management, as well as content associated with the anesthesia and nursing professions. So we have a great list of podcasts lined up, and we're excited to see what's coming.
How's it going, everyone? My name is Ben Wallman. I'm another co-host alongside Eric and Dylan here. I'm just going to tell you guys a little about the nursing training that kind of goes into the nurse and anesthetist training as well. So for anyone that's unfamiliar with that past of what nurse anesthesia training looks like, we're each former critical care nurses with a variety of different backgrounds. So combined between the three of us, we have a total of about 10 years of ICU experience and have been a student registered nurse for close to a year and a half. So we've had a variety of certifications between the three of us, including the CCCRN, the PCCN, the CMC, and the CSC. A couple of resources that kind of help with these, with being able to pass those exams are the Barron CCRN review, the AACN review course and questions, and Evolve Elsevier Past CCRN question bank.
So for the remainder of this introductory podcast, we're going to talk about our nursing backgrounds and then provide some advice for any nurses looking to enter the ICU specialty, any current ICU nurses, and for anyone that's interested in the CRNA specialty in general. And then we're also going to include our why for entering the CRNA specialty and kind of what keeps us going throughout the difficulties of the anesthesia training and curriculum. So without further ado, Ben, go right ahead.
All right, appreciate that, Eric. So yeah, as I was mentioning before, my name's Ben Wallman. I'm initially from Seattle, Washington, and now I'm currently about almost a year and a half into our CRNA program alongside Eric and Dylan here. So kind of a little bit about my background. I kind of did a little bit of a non-traditional approach if your goal is CRNA right away, where I started actually for my first 16 months of being a nurse, I started in a cardiac telemetry step-down unit. I did get a lot of great experience out of it. However, it was non-ICU. So I did that for about 16 months. And then I went and directly transitioned into a fellowship into the cardiac ICU. It was half cardiac surgical, half cardiac medical. We did roughly at our peak 25 to 30 open heart cases a week. So it was pretty high intensity, quick turnover with those types of patients. After a little over a year in the CVICU, it was around the peak of COVID. I think maybe about 2022 is where I started travel nursing. So I did a local contract in Seattle and then spent a little bit of time down in San Diego before applying to CRNA school. I applied to a total of 2 schools for my CRNA school applications, which I'll kind of get to a little bit later, but basically going into a little bit of my accomplishments and accreditations for where I applied. I had my CCRN, which you'll see is required for, I'd say 99%. I'd probably say actually almost 100% of all CRNA schools to have your CCRN. I also had my PCCN, which is the progressive care exam for cardiac step-down units. It was just an extra certification I got. I had 20 hours total of shadow experience between 2 different hospitals, one in Spokane, Washington, and then one over in Seattle, Washington. And I had quite a bit of leadership experience in the CVICU, including starting my own committee there for new grads that kind of helped transition newer grads to the cardiovascular ICU. So that's something I'm pretty proud of. In terms of advice, too, I definitely inspire a lot of people to kind of lean towards would be adaptability. So kind of like what to look for when you're applying to these CRNA programs and what, kind of the admissions are looking for is definitely adaptability. So the learning to be adaptable in uncomfortable situations is what they want to see. It's what you're going to have to do in your day-to-day life as a CRNA, and definitely what you're going to have to do as a student. So if someone asked you a question that describes you best, I would almost, Eric and Dylan may disagree here, but I would almost always say adaptability, because that really just shows that you're able to be, they don't want to see somebody who's going to be trying stepping over someone else's toes. So I can't really say enough how being adaptable will lead you to a lot of opportunities. Something else I kind of want to touch on too is personality adjustments as well. So you're going to see, even you probably, if there's anyone out there who's already a registered nurse, you're going to see some definite personality. You've already seen different personalities that you have to deal with whether it be the doctors, the dietitians, the physical therapists, or even your own coworkers as registered nurses. You're going to see a variety of different personalities. So learning to adjust and how to talk to each person, you're going to have to do that with different patients as well, which you're already doing as nurses. It's very important that, you kind of cater your care and also how you talk to people in, a certain way of your own style. I would recommend just kind of, talking to as many people as you can and kind of learning, certain things that trigger one person, but might not necessarily, be the same kind of adjustments you may need for someone else. Alongside with that, just being able to be personable with your patients and your staff will lead to a lot of opportunities. So that's why I recommend whenever you're in the ICU, or even if you're in a floor staff position, to just join as many committees as you possibly can. The more exposure, the more experience, the more leadership that you have, the better it looks on not only CRNA applications, but just in your career going forward. And it really will open up a lot of opportunities. You never know who you're going to meet. Another thing I'd like to touch on too, past that, is kind of learning to pick your battles. This will definitely apply not only in the ICU, but, kind of speaking a little bit on CRNA school itself. There might be certain things that I'm sure Eric and Dylan will attest to a little bit later here. Is just, there's certain things that are worth it to say, but also you kind of just have to bite your tongue and just kind of go with the flow on other things. You'll even see this. You'll hear some professors even say, it's like, would you rather be happy or be right? So, you really got to learn to kind of pick your battles and know when it's the right time to actually, stand up for patient safety, or if it's one thing or the other, because not everything is absolutely worth it. Something else I think is incredibly important too is having a growth mindset, because I really do think that this is something that everybody is able to change on their own. It doesn't really matter genetically or physically or where you grew up, as long as you have, kind of an open mindset, a growth mindset of wanting to be successful and be better every single day. 1% better every day. That's going to take you pretty far, because, all three of us have definitely had times where we're definitely seeing, it gets very tough in CRNA school. And there's some days you're dragging your feet and you're like, do I have to study 12, 16 hours again? Do I have to practice a central line placement? Do I have to practice another intubation? And the answer is yes, because you need to get as prepared as you possibly can for not only the safety of your patients, but for your own career as well. So just having kind of a growth mindset and looking and being more open to these opportunities, instead of saying, oh, this sucks, just think all right, I'm getting better. This is going to get easier. Every time I learn it, it gets easier. And I can't emphasize that enough. I think definitely the mental battle in CRNA school is definitely one of the hardest things to deal with. So as long as you kind of have that mindset of, it's not only is it always going to be okay, but also that you're growing and you're learning each time, instead of saying I just don't even know what I'm doing, I don't want to be here. It really just makes the world of difference. And finally, my last kind of set of advice for everyone out there is kind of I can't emphasize this enough, and I wish myself would have done this more in the ICU, is to understand kind of the why of what you're doing while you're working as an ICU nurse. And that applies with, giving medications, the treatment behind each patient pathology, knowing their history, understanding what you're doing and why you're doing it. And I feel like I didn't do that enough. I mean, I feel like I did to an extent, but not to the level of as I should have, like really getting down to that pathophysiology and physiology and understanding, like, why are we on these certain ventilation modes? Why are we using milrinone over dobutamine? Why are we using for these rapid sequence inductions? Why are we using succinylcholine over rocuronium? So really understanding that why will just make life so much easier for you.
Ben, I liked everything you had to say, especially with regards to your point that you made for having a growth mindset. This relates so much to perseverance and resiliency in both ICU nursing training as well as CRNA school. I think I speak for all three of us when we say that we're seeing right now in the midst of probably the hardest portion of our program in terms of the didactic education, we're seeing the importance of the resiliency and perseverance, and just to take every single day as a growth opportunity and a chance to develop your clinical skills and have a better impact on your clinical practice later on down the road. So thank you for providing us with your background, Ben. Thank you for giving us that advice. And something that I wanted to talk about as well is the reason why we wanted to enter the CRNA specialty. So if you don't mind going into that a little bit, please do so.
Definitely. So, why I chose CRNA, it's definitely, coming from Seattle, it's not a talked about profession as much in Seattle due to the lack of schools in the area. We have one school and it's in Spokane, which is 4 hours east. It's definitely not talked about as much because people just really aren't willing to kind of give up their whole lives, and you can't really commute. You really have to pick up your whole life if you're going to do it. So I learned about CRNA school when I was in high school. It was briefly mentioned to me by my dad, actually. He is a financial advisor and he had a client who was a CRNA, and he told me, he's like, yeah, Ben, since you're going into nursing, you should really check this out. Like, this guy, he loves his life, and you should give him a call, or just I'll set you up with him when you can. And I talked to him, and pretty much this goes for every CRNA I've ever talked to. It's just no one's ever hated their job. I mean, they all love what they do. The satisfaction of what they do with their patients, it's like no other. And then also just like the autonomy that you have with doing things. It's like it's much different than the autonomy of having a nurse, of being a nurse as well. You got to put in central lines, intubations, spinals, epidurals, arterial lines. And then, finally, I've also just always been super fascinated with kind of the anesthesia effects on like memory and sleep. It's just been interesting to me. It's like that you can basically put somebody to sleep within 10 seconds. I don't know. It's kind of wild to me, but, I'm excited what you guys have to say about this stuff, but, that's always been the why for me.
Dylan, what about for you? What was your background like in terms of nursing? You're the oldest one of the three, not saying that we're, all pushing the elderly age anytime soon, but,
Ben's the same age as me.
Yeah,
I just turned 27.
So go ahead. What's your background like as an ICU nurse?
I've worked in the MICU for roughly 5 years. I did some local travel assignments in some other ICUs, which were like CCUs and like some surgical trauma ICUs. But mostly my experience came from COVID. So a lot of patients who were intubated and just like super septic, very sick patients up in the ICU. And then I always aimed to go to level 1 trauma centers because my goal was to do CRNA school. So getting in those high acuity units is very important. And then I got my CCRN and CMC, just like almost everyone else who will apply for school. It's a hard requirement basically to get into school these days. And then I took the opportunity to shadow a lot. I got roughly 50 hours of shadowing, and I didn't do it all at once. I would do it sporadically, just to keep my dedication, drive up to get into school, because I would see what they would do. I would see how efficient and how confident these providers were, and that's what I wanted to see in myself. So I kind of just tried to manifest that. So I would go and shadow every couple months during applications, even when I was already getting my interviews. I would use those shadowing experiences to help with my experience, like help explain my experience and why I wanted to be in the OR as a CRNA. And then additionally, like I took a lot of the time to in my ICU, I like always took like leadership roles. Like I was a rapid response nurse and charge nurse. We were short staffed a lot of times, so I kind of stepped into those roles early. But I feel like kind of got thrown into it, and it helped shape me into a better nurse. It helped me work. I gained a lot of confidence, and like with the support of some of my older nurses, I was able to get like very successful results in my ability to respond to situations. So I use that a lot with my application. Some advice I would say is make sure you're passionate about what you do, whether ICU is your end goal or if you like to go back. The way you present yourself and like the way you talk and you're passionate about topics goes a long way. Your patients see it every day. Can't tell you how many times I've had a patient tell me like, oh, like you're very passionate, like, and like they enjoy that. They enjoy to see that you're happy to be there with them that day. And then same with physicians. If you have a physician who like sees that you're like willing to go the extra mile for their patients, they're very grateful, and like that's going to be big when you're getting into school looking for letters of rec. And then even program faculty, so they're looking at that. They're looking how you respond and like what you're doing. If you're disinterested during your interview, it shows, and it's hard to. They can read you very easily. They can tell exactly what you're thinking, whether you actually want to be there or not. Whether that's even just following up after an interview. I think passion is a big component. Another thing, I would say start taking some mental notes on how you interact with others. There's a new field kind of emerging, which is emotional intelligence. I think everyone, like, if you don't understand what it is, I definitely didn't when I was first applying to school. So first thing I did is after I applied, I didn't get in my first year round. They told me to look into emotional intelligence. I went on Amazon and bought a book. EQI 2.0, great book. It teaches you a little bit about emotional intelligence and how to begin to apply it to your scenarios. I think that's a great component if you're looking to, one, even just like better yourself. Like Ben was saying, growth mindset's big. And I think part of that is EQI, learning how to like communicate with others, learning how to control and adapt to your own feelings is very big, especially in the ICU. And when you're a CRNA eventually, you're going to be in a lot of stressful situations. And if you can't regulate yourself, how are you going to regulate the environment?
Absolutely.
So learning that early on and learning how to like talk about those scenarios is going to be a big benefit to you.
So
And
Dylan,
then,
I have a quick question for you.
Go ahead.
So when you got denied or whatever waitlisted that first year, what was kind of your mindset going through? Was it like, did you get, I mean, obviously you told you picked up the book, but like, kind of walk me through how you felt during that moment and like what you did to kind of get better.
Yeah. So initially, obviously, like everyone, I mean, it hit hard that first day. Definitely kind of like sulked for a day or two about it. And then like I said, I hopped on Amazon the next day. I said, like, all right, that's not it. Like next year will be my year. So like I'll apply again and I'm going to get ready starting today. I'm not going to wait a couple months. I'm not going to be butthurt too long about this because I know that I can work on these things now. And if I wait longer, then it's going to be harder to get back the time I lost. Pretty much, I think that same week I had already gotten the book and I think I had read it by like 2 weeks after that interview. And then it's not like a read that you have to just like fly through. It's just a book that you want to like read slowly and kind of start to use some of their techniques. And then as I learned some of those techniques, I applied those throughout my experience in nursing. I would start to like deploy some of the things I learned, so like how to regulate my emotions, how to notice my emotions. I especially tried to be aware of it, like when I was in like high stress emotions, whether it's with codes or with like interactions with family. Just making sure like I can try to like help regulate their emotions and also regulate mine. I thought that was helpful. But yeah, I think everyone, you always have to take at least a day to sulk over it, get your emotions out, but you got to move on because there's time to grow. And then the other thing I would say is like understanding like what Ben said, like understanding the why. You do something important, don't just follow orders. I think all three of us will constantly say this because, like Ben said, like I wish I did this more now. Because as we're learning things in pathophys and we're learning about these medications, things are starting to make so much more sense. and the disease process make a lot more sense when you're able to treat a disease if you know what the
Absolutely.
medication
If
does.
you understand why you're doing something, especially when it comes down to pharmacology and pathophysiology, everything else just falls into place and makes that much more sense, and you're able to make the connections a lot easier. So I absolutely agree with both of what you guys said. And just to continue on, Dylan, why CRNA for you? Ben talked about how you kind of dealt with some adversity, getting waitlisted the first time, and I don't want anyone to misinterpret that not getting into CRNA school the first time is the end of your career, because it's not. It's absolutely not. I think that we live in a very instant gratification society where people want, at a moment's notice, they want immediate feedback. And so I think Dylan's story is a perfect example of how you can continue to work hard and develop yourself, and you'll see the end results. So by all means, this is, although we are both, or all three, obviously in school right now, not getting in the first time is not the end of the world. So I would just continue to work hard, develop yourself, and ask for feedback. I think is what we talked about. Asking for feedback, growing your emotional intelligence is imperative to your development as a future CRNA. So just continue to have that perseverance no matter what happens. And so Dylan, along with that, why CRNA for you? Why do you want to enter this CRNA specialty, and how does that go along with your adversity through the application process?
I think like CRNA, like I've always wanted to, I kind of like Ben found out about it in high school, and it's kind of always just like been in the back. It's been in the back of my mind, like whether like eventually I'll get there. I like knew I was going to go into nursing kind of like as like a sophomore is when I decided. I think that's what I wanted to do. I wanted to be in healthcare, help people. And I just knew like from past experiences, like, nurses work closer with patients than physicians usually are. You're bedside, you're constantly with them. And I always liked that aspect of it. And that was just from like experience of like breaking some bones when I was younger, being in the ER randomly, whatnot. And then also just like seeing like family members in the hospital where their nurses were the ones taking care of them. So that was kind of my push towards nursing. And then as I learned more about CRNA school, I found it very fascinating, just like the ability to put someone to sleep, like Ben said, but also the way to take away the perception of pain. You can do these surgeries, these very invasive surgeries, and like do like a lot to someone and prevent them from having pain. And you have the knowledge to help like get them through those like tough times in their life, which I found very fascinating. The autonomy. Everyone knows you're very autonomous as a CRNA. You're able to do a lot of your own skills like line placements, peripheral nerve blocks, epidurals, spinals. So you have like a lot of control over how you treat each patient. You can tailor each case to that exact person, whether they want something, whether they don't. So like if they don't want to be put under to sleep because you're worried about how their heart will be, you can tailor that so that you can keep them awake, but you can make sure that they're not in pain throughout the procedure. So those were like the things that really fascinated about me, about the field. And then, like I said, I kind of always wanted to strive to get my doctorate degree. So like I knew it was either going to be like nurse practitioner or CRNA. And just like as I learned more about the CRNA field, I thought it was, and like how the CRNA represents himself as confident and just like very, very personable people. It's like exactly how I wanted to see myself. So I kind of just used that to manifest it.
Awesome. Thank you for that. So in terms of my background, I did about 2 years of ICU full-time in a medical surgical ICU. I actually met Dylan on one of his travel assignments. So I've known Dylan for longer than school. And even when I first met him, I knew that he was a great guy. And now he's one of my best friends in school. So that medical, not to get all sappy, but so the medical surgical,
not me though.
Yeah. Ben's just
No.
we just found him on the side of the street. So medical surgical ICU. And then I also we did have some CV surgery, not as high intensity as Ben's, but we probably did anywhere between, I would say, like 5 to 10 cases a week in our busiest time, depending on our surgeon availability and just overall scheduling. So I did have my CCRN. I took that at about 10 months. We'll talk more about that in future episodes, but you can take it with like 1,750 hours of ICU experience. Then I also had about 50 hours of shadowing as well. In addition to that, I also had some leadership experience. I was what they call the student nurse ambassador. So I helped just kind of be a clinical liaison for nursing students that had clinicals dedicated to our unit. There was a College of Nursing connected or affiliated with my hospital. So we had several nursing students, but I would have 1 to 2 nursing students, and then they would do like a day or 2 of clinical a week. So I would help train them, introduce them into the ICU field, and hopefully give them a good experience as well. And then I also did pharmacology lectures for critical care medications for both ICU nurses and IMC nurses that were entering the units. So that was very nice, and I love doing that sort of stuff. My advice for anyone, whether it be nurses, SRNAs, anyone looking to enter the CRNA specialty, I would say is that a lot of these, Ben and Dylan have alluded to it as well, but a lot of it is about perspective. You're going to have good days and you're going to have bad days. And so I think trying to just never be too high and never be too low. You're going to have days where you do really well on an exam, but then the next day you fail at fluency. So it's definitely, there's highs and lows, but trying to just keep an even keel mindset is a high indication of emotional intelligence and a high indication of perseverance as well. And in addition to that, I would just say respect everyone. Respect goes a long way. In addition to what Dylan said about passion, realize that the people that are cleaning the rooms, cleaning the floors, the maintenance, the custodians, they are no lower than you, and they are just as important to the function of the hospital as anyone else. So I would say treat everyone in the hospital with respect and value work towards the ultimate goal of keeping patients safe and having good outcomes. Go out of your way to take difficult patient assignments. I think that sometimes this can be scary for new grads or new entry into the ICU, but definitely push yourself. Growth does not come in comfort, and so push yourself out of your comfort zone in order to grow as a nurse and to expand your knowledge. And then, like we all said so far, I'm just going to reiterate the understanding the why as to what you're doing something, especially, as I said, pharmacology and pathophysiology. If you can understand the why, you will see that when it comes to CRNA applications and the interview process, if you can understand the why, you will be just fine. So more on that to come. We'll provide some resources in further podcast episodes talking about what we did to kind of expand our knowledge and get a more in-depth education as what we got from nursing school. So you obviously don't get a whole ICU class in nursing school. There's a lot of on-the-job training and really personal education as well that you have to go out of your way to do. So in terms of why CRNA for me, I kind of had probably a similar route to these guys. But when I was in high school, I wasn't really sure what I wanted to do. My dad ended up getting in a car accident my junior year of high school. And no, this is not a sob story. More so, he just had always talked about, it was a pretty significant car accident, but he had talked about how reliable and how amazing these first responders were, and the flight nurses, the trauma team when he got to the level 1 trauma center. So that kind of planted a seed in my mind to be able to maybe enter the healthcare field. And then when I learned more about the nursing specialty, I decided to go into nursing, not really knowing what the CRNA specialty was. Lo and behold, in my second week of nursing school, I ended up having appendicitis. And for me, it was just kind of the first time I've was put to sleep that I can remember. But the anesthesiologist, the impact that he had on me was fantastic. His bedside manner and his ability to just take away my nerves and say, I'm going to be with you the entire duration of the surgery. I'm going to be monitoring you. I'm going to be making sure that you wake up and pack you with no pain, no nausea, and that we can get you home. Was just so reassuring to me. And I knew at that point, if you can have as much of an impact as you can in that 10-minute conversation preoperatively, this specialty was for me. So I ended up doing a project on it a couple of weeks later in my first semester of nursing school. And then when I shadowed, it was all cemented to me that that's what I wanted to do. I loved the responsibility of being at the head of the bed, and the fact that CRNAs and anesthesia providers, the knowledge that they have that then transfers directly into the care of the patient, into really the specific anesthesia plan and how it can differ from patient to patient, was amazing to me. So I really just fell in love with the specialty, and at that point I knew that's what I wanted to do, and was motivated to get into school. So all in all, I would just say that the overall goal for CRNA prep, and this kind of goes alongside with ICU nursing and becoming a better ICU nurse as well, but I would just say make it a goal to try to find a high acuity ICU to work in, and then take high acuity patient assignments as well. This goes a long way in terms of your knowledge and your development. You might ask what some of this entails, and I think that it's kind of a false sense of, oh, I have to enter a level 1 trauma center. I don't necessarily think that's true. I would just say get into a place that takes sick patients, that you can take ventilated patients with hemodynamic monitoring, like CVCs or arterial lines, and then also the use of vasoactive medications and your understanding of pharmacology as well. Look for units do things like continuous renal replacement therapy or CRRT, the intra-aortic balloon pump, Impellas, ECMO, LVAD, all of the above. And you don't necessarily have to be in a place that does all of those. I would just say use that as a guide in terms of looking at stroke centers and CV, places that do CV surgery, and then hospitals that are kind of a transfer hub for smaller facilities is a good indicator that the ICU is high acuity as well. And I would say make the most out of your experience. That you don't have to be, like I said, you don't have to be in this huge academic level 1 trauma center. As long as you make the most out of your experience, that's what the CRNA interviewers and what the faculty members are looking for. As Dylan noted, learn from experienced nurses and physicians. If you go into an ICU thinking you know everything, and it's the same for CRNA school, you are going to get eaten alive and you are going to get humbled very quickly. So
that veteran nurse that has been a CV nurse for longer than you've been alive, you probably want to follow her around to learn a few things.
She might be a little brash and might be a little rough around the edges, but those types of nurses will make sure that you become a very high quality ICU nurse. So as we said, volunteer for leadership positions, go out of your way to get clinical certifications, to get trained in things like CRRT and for taking hearts. And then also I think a big push too, and I think we're all three seeing the effects of it now, is try to train on vascular access. Your skill with an ultrasound goes a long way in terms of regional anesthesia. And if you can get skilled at line placement, and it doesn't necessarily have to be like PICC lines, it can be peripheral IVs, it can be midlines. If you're skilled at that, just the dexterity and the hand-eye coordination of using the ultrasound helps you a very long way in terms of utilizing it for regional anesthesia. So without further ado, we're going to talk a little bit more just for the overall CRNA prep. So Dylan's going to talk about trusting the process, and let's go from there.
Yeah, so beginning in the ICU, whether you're a new grad or have like 10 years of experience, it's never easy, especially like when you're moving to a new unit. Even like taking travel assignments, I think it's a very interesting way to kind of see how you can adapt to change. I highly recommend, if you have the opportunity, to take a couple travel assignments and just like learn to adapt and see how you like start to fit in with like different groups, because it's it goes a long way to show that you can work with different teams, you can work in different places, you can learn to work with different physicians. It overall will help you as a person and just gain that experience of working in uncomfortable situations, especially early on. And then make sure you're patient and take every experience as a learning experience. Whether you think you know everything, like Eric said, there's going to be something that you probably don't know, or you don't know as well as you thought you did. So make sure you're kind of like looking at each patient differently and trying to learn something from every patient you take care of. And then, like I previously mentioned, I think emotional intelligence will take you a long way in CRNA school and just like in the profession. So start trying to build your emotional intelligence. We're going to hopefully dive more into this in a later podcast episode.
Yeah, and if there's a theme of this podcast of what we've said today, it's definitely, I'm going to keep reiterating it, is just knowing the why of what you're doing in the ICU, because I know it's really easy day to day to just kind of go through your motions and make sure you get all those tasks done, but really understanding the why when you have any sort of downtime is just going to take you such a long way, and I can't emphasize that enough. So we'll definitely get into that later.
So all in all, we're looking to build more on this podcast. For what is to come, we're going to talk about the CRNA application process. We have a pretty special guest coming on to talk about that has been part of he's been an assistant program director and part of the admissions process for many years. And so we're going to have him come on in the next episode about the CRNA application and what makes a good CRNA applicant, along with some other ones. We're going to do a podcast series on the potent inhalation agents. Those are pretty foreign to any ICU nurse or any nurse in general, just because we don't use them. And then also just talking about the CRNA profession in general. We have a very special guest talking about CRNA advocacy and some of the difficult political discussions that can occur in our specialty, some of the things that not a lot of people talk about. So with all that being said, I hope that you guys really enjoyed this first episode and can use it as a resource for across the continuum of CRNA preparation and for really preparation in the ICU as well. So I thank everyone for taking a listen. Thank you to Ben and Dylan for tagging along with me. More on this to come, and we will talk soon.